But welcome. My name is Deborah Dahan, and I'm the Knowledge Mobilization Officer here at the Canadian Partnership for Women and Children's Health, or CanWaCH. And we're really excited to be serving as the coordination center for the Pan-Canadian Women's Health Coalition, a network of 10 incredible research teams and community partners across the country that are working in critical areas of women's health research. Thank you for joining us today for another session of our virtual Grand Rounds series featuring one of those research hubs. Just a reminder that those Grand Rounds are an opportunity for you to not only hear about the work that those research hubs are doing, but also an opportunity to spark new ideas for collaborations and partnerships. And so we invite all of you to contribute actively during the presentation by sharing questions and comments in the chat, but also afterwards, we invite you to reach out directly to the hub for any follow-up conversations. It is now my pleasure to welcome Dr. Annick Bérard from the Healthy Pregnancy Hub to kick off today's conversation. Dr. Bérard, over to you.
Thank you everyone for joining in today. Very happy to be with you. Mostly very happy to get your thoughts because we're gonna make you work a little bit at one point in time in the presentation. And sorry for being late, Amy, which she's gonna talk a little later. Actually, the Healthy Pregnancy Hub is in an event right now with mothers and babies. So we got Amy out of the room. I don't know how she made it out, but she's here with us. So we're very, very happy. So Amy is gonna have the control of the PowerPoint. Can I have the next slide, please? Oh, yeah, okay, all good, Amy. Before I forget, you're going to see at the upper hand right side corner of your screen, you see a QR code. If you go on this, you're going to have a nice little video just really highlighting everything that we're doing. The Healthy Pregnancy Hub is one part of a major initiative, which is the Canadian Mother-Child Initiative on Drug Safety and Pregnancy. And now we're going to talk about our knowledge dissemination arm. But if you click on the video, you'll see we do research, we do training, and obviously knowledge dissemination. So who are we? So who's going to talk today? It's myself. I'm the PI of the Healthy Pregnancy Hub that is funded by CIHR. But we have many valuable partners. They're listed on the right, and the right column of the slide. And we work really, it's not just for show, we really work with them. We do many things with them, and we oftentimes pick their brains just to see, how we can basically address bring the research to their community. So this is me, Annick Bérard, and who's going to talk as well is Dr. Modupe Tondebias. Modupe is an OB-GYN. She's at the University of Toronto and North York General Hospital. Modupe was she was the founding member of the Black Physicians Association of Canada, and obviously she's one of their valued members, and she's very much involved in the Healthy Pregnancy Hub. She's the co-PI actually of the Healthy Pregnancy Hub, and she's going to come and talk to us today. There's also Amy Roberge. Amy is really the heart and soul of the Healthy Pregnancy Hub. Without Amy, we wouldn't be able to be here today. You talk about pregnancy. I think this hub is really Amy's baby. So she went from -9 months, and now she's 1 year. Just for you guys to know, the Healthy Pregnancy Hub is celebrating its first birthday in the month of November. And so she's our coordinator, but just for you to know, she's really the person, the go-to person, and she's the reason why this hub is actually alive and kicking. And Amy is going to come and talk to us today as well. Amy, Can I have the next slide, please? So this slide is not for you to, obviously, to read, but it's just for you to know, although there's 3 of us today, it's a team effort, right? So we have a lot of people behind everything that we'll present to you today. We have scientific experts, obviously. We have content experts. Here you see medical experts, those who help us really bring the research that is quite technical many times, but in a lay public format. And so bring the research to those who are prescribing, so the prescribers, but also the people with lived experiences and the general population. We have trainees who are pivotal to our work. And also we have many organizations with which we collaborate. And here we don't see it, unfortunately. This is really unfortunate because we have many people with lived experiences that are actually working really hand in hand with us, and we have a beautiful, very healthy relationship with them. Next slide, please. And I said that the Healthy Pregnancy Hub is funded by CIHR. It's also supported by CHUS and Justin. So it's our partner in crime. They really help us and they support everything that we do. And these pictures are actually a year ago, if you can believe it, when we launched the hub at CHUS and Justin. Next slide, please. Again, this is our first year. I'm repeating myself, so we're going to go to the other slide. So what is our mission? I said it before. There's not a lot of research on medications in pregnancy. Medications are oftentimes not studied in pregnant people before medications are actually put on the market. And obviously, pregnant women, they have conditions, comorbidities, very similar to their peers that are not pregnant, and they will take medications for which we have very little evidence, although more and more, but still it's not as evidence-based, if we can say, compared to the cardiovascular field, for example. But there's still every year, really high-level scientific publications that are published, but these publications oftentimes do not reach prescribers. They're in scientific journals, so they don't reach prescribers, and they certainly not necessarily reach the overall population, the general populations, and many times there's a lot of misinformation. So our mission at the Healthy Pregnancy Hub is to make scientific evidence on medication safety during pregnancy accessible, reliable, and easy to understand for everyone. So right now, Amy is gonna show, our tool, our infrastructure is in the form of a website, but an interactive website that we actually update every month, if not sooner, depending if there's a hot topic. For example, Tylenol and autism. Last September, I can't really remember who said that, but I think someone said it. And then, so it is important for our hub to respond to these statements. So in 2024, this is when we started the hub in November 2024. So for the past year, we put this mission into action, and we developed from de novo our website. And now, a year after, we have over 20,000 visitors, new visitors. We've produced 66 bilingual fact sheets, and we engage with hundreds of families across Canada. You'll see it when Amy's going to present the website. We have videos, we have infographics, we have testimonials. So it's pretty inclusive, and we have a chat bot within the website. So we're always listening, to what women or the population or even prescribers are saying, and we respond to it. We're pretty reactive to what they're asking. And next slide, please. So I said it before, why medications in pregnancy? We're always thought that pregnant women do not take medications. They're in a state of bliss. But 75% of pregnant women in Canada will use medications to treat chronic conditions that they had before pregnancy or to treat conditions that are triggered by the pregnancy. You can think of nausea and vomiting of pregnancy or infections, for example. So 60, okay, so, and this is even more prevalent when you look at the label. 70% of women will breastfeed while taking medications. We have even less data on this, but 90% of all approved medications right now on the market, if you look at their label, it's written contraindicated in pregnant and lactating women. But we know very well that the medications are prescribed. They need to be prescribed many times, but they're prescribed many times out of a concrete evidence-based guide. Next slide, please. So why is it so important? I'm hoping this comes directly from our the Healthy Pregnancy Hub website. So I'm really hoping it's gonna. Oh, I don't have that. Can you start? So
I can click on it.
Okay, hold on a second. Sorry, Amy. So this comes from a valued person with lived experience. Lori Prue has an autoimmune condition, and she has been really partnered. She really partnered from over a year now, if not more, with the hub and its activity. She participated in making videos, and this is one of them. Okay, so let's see if it works. So Lori is one of many people with lived experience that actually work hands-on in the hub. So we rely on their expertise, their lived experience, obviously, and to do everything, outreach, but also research.
So I did everything I could to plan for pregnancy. I changed medications, I asked questions of my healthcare professionals, I planned ahead. But when the moment finally came, I realized that I didn't have enough information. So there wasn't clear research to say, take your medications or not. I was diagnosed with juvenile rheumatoid arthritis when I was 14, and later on in my 20s with hypertension. And so medications have always been a big part of my life. As a teenager, I remember some advice provided by my pediatric rheumatologist who warned, this medication that you're taking won't be safe if you ever get pregnant. And so that stayed with me. It's funny, it's just like a singular moment, but it stayed with me. So when you fast forward another 10 or 15 years, I remembered that. So when my partner and I were, getting ready to start a family, I brought it up early, right? I talked to my family doctor who actually referred me for counseling on all of my medications with a team of specialists. And so it was at that time that I switched one of my medications to a safer option before we even started trying to get pregnant. And so I thought that I was ready. But when I got pregnant, I felt that there was no ideal option. So for both pregnancies and with the support of my healthcare team, I decided I would stop taking my medication once I got pregnant. And for my first pregnancy, that worked okay. But during my second pregnancy, the pain got worse almost immediately, and different symptoms started to appear as well. And my rheumatologist and my obstetricians couldn't quite figure out what was going on. And so we followed up with our backup plan, which was to take corticosteroids to manage my symptoms. We started low, but by the third trimester, I was actually taking quite a bit of a higher dose. And throughout all that, I felt like the weight of the world was on me as well as my partner, right? I constantly wondered, am I doing the right thing? Would it hurt my baby to keep taking some of these medications? Or would it hurt me to stop taking some of these medications? And so once he was born, I actually felt incredible relief that I didn't have to worry about any of this in terms of my core health. But then I started having to make choices around breastfeeding. And it wasn't easy for me making all of these choices, right? But I was surrounded by support, whether that be, my partner or all these healthcare professionals that were supporting me. And one moment in particular struck me. It was from my family doctor as I was trying to make a choice around whether to breastfeed my child or take these medications. And she said to me, there's so much more to being a parent than this. And this is just a small moment and a longer life commitment. It really helped me let go of some of the guilt and kind of gave me permission to focus on my own health so that I could be the best mom that I could be at that moment in time. And it really helped me let go of the guilt and to understand that managing my health was just as important to being the best mom that I could be. So in terms of my advice to others, just remember that you're not alone. Explore resources. I've developed a number of resources with the Canadian Arthritis Patient Alliance, but also visit healthypregnancyhub.ca for reliable information and support on trying to make the right choice for you around medications and pregnancy. So just remember that taking care of your health is just as important as taking care of your baby.
Thank you. Thank you. So while we're going back to our PowerPoint, this video was actually scripted almost in real time and recorded at the end of last May 2025, at the same time as we were having our CAMCO annual meeting. And that the producer of all of this was Amy. And this is one of 4 videos that she did that day. And we have a wonderful picture at the end that really actually represents what she was doing that day. But she told me, never again. We did it once, but don't you ever come back to me with your crazy ideas. So, okay, it's noted, but it gave something really nice. It really showcased that, when you have a chronic condition, nothing is easy. You use your medication, you have risks and benefits. You don't, you have risks and benefits. And it's a very, very difficult choice. And it shows the importance of informed decision-making. And this is what our hub is trying to make. And for, juvenile arthritis or rheumatoid arthritis, which is, a disease of the young, and therefore we see many pregnant women with these diseases. Now with biologics, the new medications, it's even more, they're great medications, but we have very little data in pregnancy. So therefore, a lot of research is being started right now. I see Leah in our calls, so she's our expert in the field. Next slide, please. So highlight of last year. Last year is our first year. Over 20,000 families and professionals reached through our website that you're going to see in a moment. Like I said, 66 fact sheets that have been published on our website. We have 35 resources, so either videos, infographics, podcasts as well. We have many articles looking at parent stories, and we were lucky enough to go to Nunavut over a year ago now. My God, time flies. I saw Patty joining in, Patty Johnston, who is the expert in perinatal health amongst Inuits, and therefore we went there with Patty and her team in 2024, I think it was March, and we were able to get many stories from women there, and 2 of them actually made really a nice story that are posted on our website. Amy started a great collaboration with YEG Parents. It's from Alberta, and they have a web magazine, and Amy is writing regularly in the magazine. And obviously, we have the Black Physicians of Canada that we teamed up from the beginning through Madupe, of course, but with the whole team as well. And last October, we went to Toronto, not me, but our team. Amy was there, Madupe was there, Vanina, I saw joining in, was there. And many others, and we did a wonderful focus group with the community there. And of course, we have many collaborations with midwives, but Amy was actually, and Vanina they were actually doing a focus group right now in a community organization. And this is why they were some late. Vanina was a bit late because she was probably dealing with the kids and the moms, but Amy was there with us. Next slide, please. So again, fact sheets, podcasts, videos, infographics, and community partnership. And basically, I put this here just because, getting quote from a parent that actually participated in these events. The parent said, "I felt heard and included in every discussions. My voice mattered." And you see the picture here. You see Madupe and Vanina, and that was taken from October or November, I can't remember, but it was in Toronto. We'll hear more about it. Our top fact sheets that are consulted was on Tylenol, dicleptin, which is a medication used for nausea and vomiting, and sertraline, which is a medication taken for depression and sometimes anxiety in pregnancy. So those are our top 3 most consulted fact sheets. Next slide, please. Okay, so now we're going to turn to Amy, who's going to show us, obviously you have the link there, so you can look at it in your, free time, obviously. But Amy is going to guide you through some of the things. She won't have the time to show you the whole thing, but obviously she's going to guide you through the platform.
So, hi everyone. I'm really happy to be here. Sorry for running late. As Anik mentioned, we were with parents and I had to run to actually be here on time. It's been a very meaningful year. We obviously did quite a bit, and one of the main elements is the website that we launched on November 19th last year. So it's almost a year ago, day for day. But I really want to introduce you to what it looks like in practice and how professionals and parents can use it on a day-to-day basis. So again, like one of the core elements that we have is always to focus on inclusion, transparency, evidence-based, and collaboration. It's something that Annie's been repeating from the beginning, and it's also something that we highlight in everything we do, including the website. So once you get on the website, you get the main page. We have linked to all our different social media. I'm not going to click on them for obvious reasons, but it's really easy to follow us. One of the features that we have that's also very appreciated is an accessibility button. So people with color difficulty can have higher contrast, but you can also change the size of the font if needed. At the top, you get obviously the homepage, and under medication condition, you can get different fact sheets or resource right on one click, so you can go stroll through everything. For About Us, you get more detail on our approach. As I said, transparency is very important, so there you can find our methodology, all the partners, what we do, how we do it. Same for the team member. We are a very, very big team. There is more than 85 people on it at the moment. And for each of them, their name is there, their affiliation as well, and how they contribute. some of the common questions and how to contact us. It's with the info at healthypregnancyhub.ca. The email is checked regularly if you ever have questions, or you can always reach out to me directly. And again, obviously everything on the website is done in French and in English, so it's easy. At one click, people can change from one language to another, or even search the specific topic they have in mind. Going a bit forward, you also have the chatbot here, which is the help button. So you get to chat with Serene. It's AI generated, but one of the important thing is you can ask any kind of questions, and all the answer will be within our website specifically. So it's not going on Google, it's not being fed by ChatGPT or anything like that. It's only evidence-based information that has been validated by our expert, and that can just redirect some of the parents if they're looking for something specific and want more information. And our main search bar, it's obviously here. And just, we do have the interactive tool in case you're wondering and want to access the chatbot differently. So if I go for diabetes, you can see like everything that we have related to diabetes, click directly on it. And then the little numbers actually indicate like the content that we have in this format, specifically on this topic. We have like the fact sheets, medical condition, medication related, but also infographic videos, etc. So if I go just for our sakes here, on the one on medical conditions, so I can show you what one of our fact sheet actually looks like. So we get the one on gestational diabetes, and we get the table of content, the content. So a bit of an overview of everything we have. Can click directly to be redirected. And one of the very fun feature that we have to promote accessibility is the ability to listen to all of our text in one click. And here you can also translate in different language if you want something else than French or English. We obviously cannot validate the translation of in every single language, but it's pretty accurate for the one we actually tested. And if you go through like the fact sheet itself, you get an idea of what it is. You also have the possibility to click directly to be redirected to one of the infographics that works. It's struggling with the sharing screen at the same time. Did you get like the PDF of like, should I be screened for gestational diabetes, and like a bit an overview? And if we continue, get the timeline of like, what is the glucose tolerance test? A lot of parents actually have questions about how it works and what's going to happen. So we decided to include it. Some of the main risk factor that would lead to someone having a higher risk of developing gestational diabetes. So family history, some ethnic group that have been shown to have a higher prevalence. For example, again, all of it is always based on what we found in the literature. Then there's a quick explanation of why it's important to treat it for the parents, and all the risks that have been found associated with having gestational diabetes. The data we share is, yes, it's evidence-based for sure, but it's always compared with the baseline risk that we do explain. For example, for congenital malformation, the average in Canada is 3 out of 100 pregnancy. So we want to be like clear that it's not because you have gestational diabetes that you will have preeclampsia, for example, but it's just a higher risk. And for all of them, like parents can also go to see which study specifically says this statement. We also included a section about breastfeeding, so what happened after, if the condition continues or not, if there is specific element that should be considered regarding the medication, among other, if it passed into breast milk or not. One of the main requests that we get a lot is how to manage if there is things that can be done other than medication. So we do include like a whole section on this, and try to be as thorough as possible based on what the parents have been telling us. Again, we also have videos that can be accessible in one click, and obviously section about medication on the condition on the fact sheet, explaining condition. Then we get a basic overview of what is available and what are the main line, but then people can also click directly on the hyperlink for if they want more information on metformin specifically or insulin. And obviously, we always refer to their healthcare team for any kind of need. Again, our goal is not to tell them take this or not, is really to just provide the information, and to like help them to have the tools to then like engage in a conversation with their healthcare provider. In one view, they can get like quick takeaway. So for the moms running after their toddlers, if they just want a quick look of like, what should I know in that moment, they can do it easily here in a few bullet points. And one of the strengths, I believe, of our website is that we also say, what are the limits? Obviously, information on medication during pregnancy is not always easy to access. There is not a lot for some of the medication, and we want to be as transparent as possible with the process. So it also empower the parents to know, like, we don't have the information on this, and that's normal, and it might change, but for now, that's where we stayed. There's the link on the main resources that we have. It's easy to share. With just one click, they can either print or share it to another mom, or just to have it themselves and bring it to their healthcare provider later on. And you get to see the faces behind each of our fact sheets. And obviously, like, link to all the ones that have been mentioned throughout the fact sheet. You can get like the link directly if they want to continue. So that's a little bit of the website at a glance. And I will.
Thank you, Amy.
I'm sorry, I will have to stop sharing to go back on the other one.
Of course. Thank you. So this is one example. So this is diabetes and pregnancy, where you can see we have fact sheets. Everything is bilingual, but of course you see them today in English, but fact sheets. We on the condition, on the medications used, infographics, videos, little, those infographics, but in a clearer way, if I can say it, just for social media sharing. So this is one example of the 66 that we actually put out there. So I really encourage you to go on our hub, to share it to as many people as you can or you want, and also just come back, because we are always updating our fact sheets, obviously. Okay, so next slide, please. Are you in presentation mode? Yeah?
I think I am not.
Okay.
What is happening? Okay. No, it worked.
Okay. Wonderful. So we want you to talk to us. Basically, we're going to make you work. So how does it work, Amy? So there's a QR code.
Yeah, there's a QR code, and I can share the link directly in the chat as well if it's easier for some.
Okay. So just download the QR, well, screenshot the QR code. You're going to go see the question. And if I remember correctly, Amy, we're going to see the answers right away, right?
We should. We already see like one person typing, so it's a good sign.
So the question is, what is your preferred knowledge transfer format for healthcare providers? So remember, you have videos, you have fact sheets, infographics. So what is your preferred format? This is informative for us, just for you to know. It's anonymous, you know, you won't have your name will never appear, but we're going to use them. Those clouds, we're going to save them and use them for to help us better the website. So fact sheets and infographics. This is for healthcare providers, right? Just remember.
Yeah.
How many do we have? 9? We're 22 here. So let's go. I want to see 22 answers. It's easy to do. I feel like I'm an auctioneer, you know? Okay. So who, oh my God, one participant is typing a lot. I mean, okay, let's see. Amy, is it possible to see, do we have the full cloud on the screen? Yeah, I guess. Yeah, we do.
Yeah, we do.
Yeah, we do.
It's just like every time people put an answer that is already there, it gets adjusted.
Okay. Okay, so we're gonna wait maybe another 10 seconds. But we do have newsletters. We forgot, we didn't mention it because we have so many things to actually talk about. But if you go on our website, there's at the bottom, I'm assuming, there's a place where you can register.
Yeah, it's at the foot.
To have our newsletters. So it's going to come into your email, you know, every month or so. So, okay, so I think the two winners are for healthcare providers. So basically to share with their patient is really fact sheets and infographics. I think it's equal, right? I think I'm not wrong. Okay, wonderful. So thank you very much to all the participants. Let's go to the other slides. I think we have another question. Okay. Is it the same QR code, Amy?
Yeah, it should be. It should automatically switch to the next question.
Okay. So now, what is your preferred knowledge transfer format for people with lived experiences? So obviously, we're at the well, I'm assuming that it's going to be different, but I could be wrong. So please tell us. Okay. Videos. I'm going to let you work a little bit. Okay, audio, yeah. While you're doing this, I'm just going to tell you a little story. When we first started the hub, we had to identify, I saw Catherine Laure is on the call today. With Catherine, she really forced us to say, okay, because she's a knowledge transfer expert. She says, okay, what is your population? Who do you want to talk to? So we were like, we want to talk to everyone. She was like, no, you have to identify your main target population. So the main target population for us is the general population. But as we were talking to you know, prescribers, physicians, pharmacists, because they can prescribe now diclofenac, among other things, antibiotics. They were saying, yeah, but we need information as well. So they come as well. So we're trying, this is why our format is so varied, is because with one important information, we want to reach the majority of people. So you see, it's very different. You know, people with lived experience or the general population really like videos, that we knew. They like infographics, but their favorite one is videos, and videos of people with lived experience. This is what drives the message home the most. So, okay, great. Thanks everyone for participating. That was very nice. So, I have a feeling that I'm repeating myself again. I'm just going to go at the bottom of this slide. Just want to, you know, tell you where we reach the most people. We're on every social media platform. Talk to my team. Every week they do a little TikTok video or something. I don't know, Instagram or something like that. So Facebook is there, okay? We have a lot of people we reach a lot of people on Instagram, LinkedIn, but TikTok. Now, the Healthy Pregnancy Hub teamed up with a media company, agency, and not now because we're doing our 1-year anniversary, but starting next in December, I'm assuming, hey guys, we're going to start really relying on them to do our social media campaign. It's extremely important. It's important for research, but it's super important to do outreach nowadays. If you do not do social media, you missed the point. Okay, next slide. Okay, so I'm gonna ask Modupe to tell us a little bit about our event that we held in Toronto with the Black Physicians of Canada group. So Modupe.
Yeah, thank you so much, everyone. I hope you can hear me. So my name is Modupe Tunde Bias, the inaugural past president of Black Physicians of Canada. I was not actually one of the founders. So I just like to thank everybody for, for this, website. And we had the Toronto event, which was supported by Black Physicians of Canada and the Ancestral Hands Midwife. And we wanted to get an insight from the Black and the immigrant parents in downtown Toronto. So we actually went to Scarborough, which is highly populated for the Black folks. And during the event, we had 12 participants, including 4 dads, which made it even more robust. And, it's so good to be able to take the information to the population, to the community, and it was well received. During that time, we came up with 6 themes. And the first thing which I'm going to talk about is the participant expressing concerns and uncertainty, and definitely fears and anxiety and being overwhelmed, particularly regarding the medication safety and potential effects on their baby. In particular, one participant actually said that she felt reduced to the label of a geriatric pregnancy, which contributed to a lot of her discomfort during her clinical interactions. But more importantly, the anxiety also continued around whether they continue or stop certain medications, especially for people with chronic diseases. And we heard that from Laurie, who spoke to us about that. So it's very important even for them if they have any chronic disease. Then the second theme was around information gaps, which showed that there was a gap between, understanding related to even things as simple as vitamins. For example, folic acid and vitamin D, whether they should continue using this after the birth of their baby, and whether even using herbal products was also a concern. In fact, there was also requests about clarification of things like epidural options during the labor. So these concerns actually reflect the information needs across medication safety, symptom evaluation, and also how they navigate the system. Then the third thing that we found was sources of information and support used to guide the medication and pregnancy-related decisions. Most obtained their information, as you cannot believe it, online using Google, social media, trusted website, and even ChatGPT. The second form of information being sought is through the healthcare provider. So whatever we can do to make our presence online, it's actually a place where most of our patients look for their information. And it behoves us to know that they use these multiple information sources to kind of cross-check about the information they're receiving and also to gain clarity and guidance from the information. So one source of information seems not to be sufficient. Then we got to the fourth thing, the lived experiences of pregnant individuals that contribute to informational and support needs. Pregnancy for them was constituted a physically demanding, painful experience, which was accompanied by discomfort, pain. They're not sure whether the symptoms they're facing is actually normal, whether they need to go to labor and delivery, whether they need to seek medical attention, or whether this is even a normal feeling during the pregnancy. And several participants actually told us that the common image of happy pregnancy did not align with them. They did not align with, oh, this pregnancy is actually good for them. So the normalization of a wide range of pregnancy experiences may help reduce the confusion and also the unnecessary anxiety that most participants felt. The fifth one is around self-advocacy strategies and support needed when they navigate the healthcare system. We all know that navigation of healthcare system could be challenging for some people, especially if they're from the equity deserving groups. How do they navigate that? Some participants talked about asking questions and being firm with their healthcare providers and clinicians, asking them to repeat the information so that they understand, and also asserting the ability to decline procedures if they don't understand. So they also ask their providers to slow down, take the information in small bits so that they can make sure that they understand. Some also will use other individuals that they trust, like their doulas, like their midwives, and these people play a very important role in ensuring that they are able to ask their questions and they remember the care plans and they feel more confident about the interactions they have had with their healthcare providers. So these experiences reflect a need for communication that accommodates different levels of familiarity with medical terminology and the clinical environments. And also, it provides tools that help patients prepare their questions or understand choices that may improve their confidence during their appointments. And then we ask them about the, the hub itself, whether they view this, whether it's clear, it's useful. And to our satisfaction, a lot describe it as a useful resource. They describe it as being clean, easy to access, and helpful as a one-stop shop approach for them. And clearly, they appreciated the clarity and the condensed nature of the content and the fact that there are hyperlinks that can take them to related topics. And the important thing, which I think we need to understand, is that the Black community felt that this hub actually represented them because they saw representation within the team, and also they also felt connected to some of the culturally relevant elements. And I think this is very important when you have a national hub that serves all kinds of population. The challenge they had was actually locating and accessing the website, indicating that visibility and the distribution channels may need some form of improvement so that they can have easy access to it. I think the night was actually quite good, and I'm glad that we took the opportunity and the time to have members of the hub come to Toronto to 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 discuss the hub with this population. So thank you so much for the opportunity. Thank you to um, Vanina and Emmy and of course, the leadership of Hanik. So thank you, everyone.
Thank you, Madupe. I couldn't be with you, unfortunately, but I heard only good things about it. So thank you, thank you, thank you. And everything that you said is really important information. So, very, very soon in the month to come, we're going to have a page really summarizing this event on our website. So thank you again. So I'm going to go a tiny bit faster because I see the time going, and I really want to ask my last questions to all of you. I want to show you, remember at the beginning, I told you that, we publish, but then it doesn't reach the population. And so it's just one example. As you know, in last September, the president of the US actually made a statement that I'm in Paris right now, and I can tell you everyone was talking about it, even here. About the fact that taking Tylenol in pregnancy was actually causing autism. So that was anyway, this is complete misinformation. It's pulled out of context. And it just happened that our team had just published, or was in the process of publishing, had finished a study on the association between acetaminophen, so Tylenol use in pregnancy, and the risk of any neurodevelopmental disorders. Now you can look in the American Academy of Child and Adolescent Psychiatry journal, and you're going to see it's there. So we have this research. We had to deal with this statement that came from the US, and all of this together, we took scientific data. Can you switch to the other slide, please, Amy? And we were ready to go and do knowledge translation. So we did infographics. We also did fact sheets, but we also did videos. I saw Sonia Brandy that joined in, and Sonia helped us. She's the one, the upper left corner. She did a video for us. It's important to be able to take scientific data and actually translate it to the overall population. Next slide, please. Okay. Obviously, we're always supported by the Society of Obstetricians and Gynecologists of Canada. Can you go to the next slide? Okay, next slide. I really want to do the quiz. Okay, so our priorities for next year: strengthening our knowledge offer, amplifying stories and voices of people with lived experiences, have more community partnership. This is certainly a goal and a need, and increase our digital presence, just like Modupe said, and obviously have a culture of KT, even greater. So these are our priorities. Next slide for 2026. This is our team. Next slide. These are the pictures that we took last May. No, go up, Amy. I want to show something. You see at the bottom, you see Amy there like an angel, crouching on the floor with all her scripts. So this is what she looked like while we were doing the video. All of them, including the one that you saw at the beginning from Laurie Proulx. Next slide, please. Okay, so now I want you to go back to your Slido, with the QR code. And, for you, yourself, what would be important for you? What is important when you get information regarding pregnancy in terms of medications, in terms of conditions? I want to hear from you. What would be important? What do you think either is missing or that is lacking, you don't have ready access, or you would like to have access to? So I'm gonna give you 30 evidence-based, cited sources, references, clear and concise summaries. Okay. So this is, encouraging, Amy, because this is pretty much what we're trying to do. Obviously, it's a learning curve, so our goal is to make it lay public as much as possible. And I think we're not exactly there, but we're aiming towards the real lay public language. Okay. So backed up by evidence, concise, straightforward, clear, short. Yeah. Okay, so this is great. Thanks a million. We're going to take it back. The hub is really everything that is said here, but clear key message with reference. This is certainly a priority for you and also for us. Thank you. Next slide, please. One last quiz. Which topic should we look into for 2026? Remember, we're in the business of medications in pregnancy, okay? So what would be a topic that you think? I have one that is, I'm going to tell you what it is afterwards. But what are the main topics? What are the hot topics with regards to medications in pregnancy for 2026? That was mine. GLP-1, obviously, Ozempic. And just for you guys to know, some research is starting to come out on GLP-1, Ozempics, and all the obesity drugs, but also drugs that are given for type 2 diabetes. It's starting to come out, and we have started doing research on it. So you'll hear from us. What to do about medications before, while planning. Okay, so Diana. Oh, this is interesting. This is an OC drug. Yeah, okay. So I guess women, Diana is what? It's an oral contraceptive that is good for the skin as well. I think this is what Diana is. I guess many pregnancies are on Diana. So, okay. So, but planning pregnancy, preconception, we hear you. And it's in our work load. It's just that we had to make a choice and we went for pregnancy exposure first. Next slide, please. Thank you for those who participated. So I'm going to finish here. So in May 2025, during our annual meeting, we asked the same questions actually from our CAMCO team. We're about 100. And basically GLP-1, you see upper left corner, biologics. I saw biologics as well in the cloud. And Ozempic, obviously GLP-1, and antidepressants, SSRIs. So mental health is always at the forefront. It's always an issue in pregnancy. So obviously, and so these are the topics we're going to work on in 2026. And obviously, we're going to look at AI. We're going to look at causality versus association and asthma drugs. So I'm going to stop now. We're over time. I just want to take the opportunity. We didn't have the time to take questions, but you had the opportunity to make your voice heard with the quizzes. So I'm really hoping that we conveyed to you the importance of having information on medications in pregnancy. And I'm really hoping that you'll visit our hub, give us your ideas. And if you want to be part of our hub is not a closed entity. You can email Amy and we'll add you to the list and we'll consider you a Healthy Pregnancy Hub member. Thank you.
Thank you so much, Dr. Berard. Thank you to everyone who joined us today.